Hi, everyone. Thank you for coming along to this webinar today to hear about accuRx and record access. We're going to get started now. First of all, I'll make sure I'm clicked on the right screen. First of all, welcome. So this is actually, I think, our biggest webinar to date. So we had over 1,000 registrations for this one. So people still joining now. But because of the size of the webinar, I thought we'd just run through a quick things that we expect to cover today. So we are only going to cover record access today. We'll talk about that in a demo and the presentation that we've got. I know there may be other things that people want to discuss, whether that's different features, accuRx Plus, accuBook, but I'd encourage you to either jump onto some of the support articles or to our live chat on support.accurx.com. And we also have some really good videos on our YouTube channel to go through those. So we will just make sure that we focus on record access today. The plan is that we are going to record the webinar and we will post it later on so that you can watch back if you want to, or share with other colleagues who haven't been able to make it to the webinar today. There is a Q&A function. So as we go through the webinar, please feel free to put in your questions into the Q&A function. That way we can group them and look to answer those at the end. Please also use the upvote function on others' questions just to help us prioritize both what to answer, and it will also just sort of help clear out. I think if we get near to the number of registrations of over 1,000, it's going to be quite hard to manage those questions. So voting on others and grouping questions will be really helpful if possible. The agenda today, obviously a few quick intros now, and then Jacob, co-founder and CEO, will run through our vision and talk a bit about sort of like why we're doing this and what we're doing. My colleague Satya will run the demo, and she's our clinical lead, and then Matt Honeyman, our IG and policy lead, will cover IG and security. And we'll attempt to get through as many of those questions as we can at the end of the session as well. A slight apologies, the way we set up the webinar today means you won't be able to see us, but you'll still be able to hear what we're doing and see the presentation. Possibly more of a shame for me. I even put a collar on today, so I would have looked very smart. But before we kick off and before we start the presentation, we'd really like to get some feedback from kind of the information that you have so far and the comms so far. So we're going to run a quick poll to everyone on the webinar so far. And this is the question. So with record access, a patient can give permission to share their personal medical record from your practice's medical system with another healthcare provider that is involved in their care. Would you like this feature for your patients? So I will just turn this poll on, and you should now see an option on your screen with a couple of click buttons. If you're happy just to click either yes or no as we go through, and we'll share the results afterwards. This is really interesting for us. Obviously, this is some quite early engagement as we're going through this, and we're just keen to see and understand, how useful this is and how we prioritize features and understand kind of what's next and what's coming next. So that's brilliant. I think I can see about 70% of people have already voted. So I'll just give it another 5 seconds for anyone else who still wants to send those through. Fab. Okay, I should now if I just end that poll there, and then I will quickly share the results so that hopefully everyone can see that. Just so, as I said, this has been really useful and interesting for us just to see how we're communicating this and the information that's coming through. So thank you very much. We'll be running another one at the end, but that just helps me sort of have a bit of context before we start the session. What I'm going to do now is pass over to Jacob. So I will just give Jacob control of the screen so that he can go through his slides. And I'll go on mute. That should be good for you to go now, Jacob.
Great. Thank you very much, Matt. And thanks again, everyone, for joining. My name's Jacob. I'm one of the co-founders of accuRx. And before we dive into what record access is, I want to start from the bigger picture of what's our vision and how did this come about as something we're working on. So we think healthcare is a communication industry. What we mean by that is what everyone on the front line is doing every day, making referrals, getting second opinions, coordinating care, getting information to patients. It's all communication, and we want to make that as seamless as possible. And hopefully most of you have experienced doing that with patients. Some of you might be using accuMail and have started doing it with other services as well. But really, we've got this vision that everyone who's involved in a patient's care can communicate with each other, which sounds really simple. It's generally quite uncontroversial. No one thinks it's a bad idea, but it's just very, very hard to do. And obviously that includes the patient communicating. And when we say can communicate, obviously that needs to be easy. That needs to be really accessible and a couple of clicks away. So we started speaking to clinicians outside of general practice, in community providers, in acutes, in pharmacies, and said, if you could communicate with a patient's GP, like what's the sort of information you're trying to get? At the moment, when you call up and you ring up the reception, you're trying to get hold of someone, what are you trying to find out? And resoundingly, the most common need was, what medications the patient on? Is their low renal function, is that chronic or acute? What long-term conditions they have? And a lot of information that should be on the medical record, but for whatever reason, they couldn't get access to. And so they were phoning up and either getting the record emailed over or faxed over, or getting things explained over the phone, or maybe trying to get the patient to remember or like bring in their boxes of medication or things like that. But this was one of the most, was sort of the top communication need with the GP practice that we heard. It's not to say it's the only one by any stretch, but something that other providers thought could really help them improve the care that they were giving patients. And then we were like, okay, well, how come you can't get that at the moment? We've heard, of all the lycras and summary care records and all these different ways of record sharing. And the barriers that started coming out were things like, oh, well, our lycra isn't properly set up yet, or actually a patient's come from outside the area, or maybe I'm in a provider that doesn't have access to it. I'm in a community provider and it's only the acute that does, or I'm a locum and I don't have the right permissions on my smart card, or actually what I get from the summary care record isn't enough. I want to see their investigations and I'm not getting that information. So we sort of took all of those barriers and went, how can we get to a point where anyone who's caring for a patient can get the information they need. And this actually brought up our favorite workaround. So we love hearing all the examples of innovations from clinicians, because generally, healthcare is very messy, and staff on the front line are amazing at finding brilliant and innovative workarounds. Our favorite one is we found some GPs telling patients to telling patients to take a photo of their screen at the end of an appointment, with summary of the record, and then when they go and they see someone in outpatients, to take a photo of their screen and actually build up their own version of their shared care record that they can show people. And it just shows the lengths that people will innovate to try and solve this problem. But we want to get to this point where everyone who's involved in a patient's care, they don't need to get a patient to take a photo. They can message the patient, they can message the patient's GP, and vice versa. The GP can message the other services, and they can view the patient's GP record. So that brought out this really tricky question that people have been trying to solve for quite a long time, of how do we know who should be able to see a patient's record? And the current world is based on having quite strict controls around having exactly the right codes in your smart card and things like that. But then once you're in, you can actually look up any patient and see things pretty much, any patient in that area, which is actually like quite a lot of access, but still blocks a lot of people out. So how can we solve this problem of making sure there's not friction for the right people to access a record, and it's it's seamless, it's a couple of clicks, but also it's only the right people accessing a record? And that's where we got to this point of, well, actually the patient has the best idea, a lot of the time, not in every single case, but a lot of the time, of should this patient be able to access my record? And so it's worth saying here, we're not trying to replace lycras, or this is very much an additional route for all these different providers and use cases where people can't access the record. Let's ask the patient. And so I'm going to hand over to Satya now, who's going to take us on a live demo and show you what we've built to be able to let other providers looking after your patients access their records, but really putting the putting the patient in control of who can see that. So Satya, over to you.
Thanks, Jacob, and welcome everyone. I'm just going to share my screen so that I can run through the demo. If somebody could just shout when you can see my screen, hopefully it's there.
Yep,
Got it. Fab. So like Jacob mentioned, the way that record access really works is it allows a healthcare professional to view a summary of the patient's GP record with the patient's explicit permission. So that record is only returned for 24 hours and then the view disappears. The way that you access the record is via accuRx Web. So accuRx Web is our standalone web-based platform. So you can log into accuRx Web via any kind of web browser like Microsoft Edge or Google Chrome. You would go to fleming.accurx.com. We're using our staging environment here just for the purpose of the demo. Now, to log into Web, if you have an nhs.net address, you can use the NHS Mail single sign-on, or if you have an nhs.uk address, you can register to use Web as well. Once you do log in, it takes you to this page, and quite similar to desktop, it has some of the same functionality. So you can use this to send video consultation invites to patients. You can send text messages to patients. Like Jacob just mentioned, some of you may be using the accuMail feature, which allows you to message other healthcare professionals. In this case, it would allow you to message directly into the patient's GP practice. And now you can also request a summary view of the patient's GP records. So I'm going to show you what we've built so far. The way that Web works is that it integrates with the personal demographic service or the spine, so we can return some of that information about the patient, like their contact number, like their practice that they're registered at. So to request the patient's record, the first thing that you would do is to search for the patient using their NHS number and their date of birth. So I'm going to use one of our favourite test patients here, Julie Adams. And you must have both the NHS number and the date of birth. So we don't support kind of any soft or fuzzy searches, just because we don't want to expose lots of patient identifiable data unnecessarily. So once you've got the NHS number and the date of birth, search for the patient. You can see here at the top the patient's demographic details are being returned, so you can confirm that you've got the right patient. And then to request the record, you would click Record Access here. And then you can see the patient's mobile number has been returned. So we obfuscate everything but the last 3 digits, just as a safety measure. And unlike the rest of Web, you can't edit the patient's number here. And the reason for that is the way that the record access or the patient permission side works is that the clinician sends the patient a text message. The patient receives some information about who's requested access to their record, and they also have a 6-digit code that they then share back with the clinician. And I'll show you what that looks like now. And so the reason why we don't let you edit this number is to essentially prevent people, from putting in their own mobile number in place of the patient's and getting access to the record that way. So I'll send this text message across, and that will come through to my phone because Julie's linked to my number. And the message that Julie would receive would say, Satya Raghuvanshi from accuRx Practice would like to access your medical records. To provide access, give them this code. And then there's also some information there where the patient can read about what will be shared from their medical record, and also what to do if they weren't expecting a record request. So that comes across through the text message. And then once that's come through, the clinician can then enter the code. So that's just come through now. So the patient would share this 6-digit code with me. I'd hit confirm, and then you'll get the medical record returned. And like that, it's as quick as that. So, less than 30 seconds. Traditionally, where things like summary care records fall down, I work in a hospital, it tends to be, not having access to smart cards, not knowing where to access a summary care record, and then not having the kind of full information that you need. So in terms of what we do return the medical record, you can see here you've got the patient demographic details at the top, including their contact numbers and their address. We also have a banner, so there are some sensitive clinical codes that we don't return, and those are clinical codes that are part of the RCGP and Joint GP-IT Committee sensitive data sets. So those are codes specifically relating to IVF, assisted conception, STIs and gender reassignment. And the advice from the RCGP is if you don't need to return those codes, you shouldn't be returning them kind of as routine. So we don't in this case. If we go through the right-hand panel here, you'll have the GP's details and then the practice name and details about the GP practice. We don't have that here just because this is our test environment. And then working down, you get the health status back of the patient. So that includes their BMI, their smoking, their alcohol status. investigations going back to the last 2 years, and you can see here, you know, we've got blood test results, and you've got the result, the date, and the reference ranges as well. We do know that this list could become quite long, so we'll definitely be working on making that a bit of a nicer display kind of going forwards. And then you've also got immunisations, which obviously has become far more relevant in the wake of kind of COVID vaccinations, etc. But you'll get a full immunisation status for the patient as well. And then through the main panel, you will return the problem list. So that includes active and past problems, broken down by significant problems and minor problems. The reason why we've done, why we return both kind of significant and minor is just to reflect kind of the messiness of the record. We do know sometimes accidentally quite major problems can be marked incorrectly as minor. So we've made the kind of safety decision just to return the full view for the time being. And then going down, we'll also return health admin problems. So typically things that tend to get captured here are things like, you know, the patients are breast screening non-tender, or they've had their diabetic retinopathy review on this date, etc. And then below that, in this nice bright orange banner, we return allergies and sensitivities to any medications. So you can see here the patient's got an allergy to penicillin. If there's a corresponding comment about the nature of the allergy, that will also be returned as well. And then below that, we've got the medication list. So that's broken down by current and past medications. And then within current medications, we've got acute medications and repeat medications that you can see here. The date on the left is when the medication was first prescribed. And then you can see the last issue date, the issue number, and obviously all the full dosing instructions as well. And then past medications going back the last 6 months, again, broken down by acute and repeat medications over the last 6 months. And then if you are a GP that's requesting your own patient's records, we also return the last reconsultations. So this won't be visible to other healthcare professionals outside the GP practice. And the rationale behind that is we don't want to expose third-party information unnecessarily. So if you're a GP who's using this because you're working remotely or at a care home or, you know, at a vaccination site, you could use this to view the last reconsultations for your own patients. In terms of kind of an audit trail of records that have been requested, as a clinician, you can see which records you've requested here, and you'll see how much time you have remaining as well. So once the 24-hour window closes, that will then expire, and you would have to send a new request to the patient. And this is the record that we've just pulled here. There is an explanation at the top, just so that there's kind of clear information about what each status means. On the practice side, there'll also be an audit trail. So if somebody externally has requested a record for one of your patients, you'll be able to see which patients have shared their records from your managed practice page. And that will share when the record was requested, who the record was requested by, what organisation they're working at, and also whether the record attempt was successful or not. And so that's kind of the full flow of record access, which is essentially two-factor authentication with a code that's shared back from the patient to the clinician, and then the clinician can view the record for up to 24 hours. And I'm now going to hand over to Matt, who's going to talk about the hygiene security of the feature.
Thanks very much, Satya. I think we're going, shall I share my screen fully, Matt Harrington, or am I going to control yours?
I've hopefully just started sharing, and I can give you control if that works best, Matt.
Lovely.
There we go.
I have it now. Great. So hello, everyone. My name is Matt Honeyman. I'm the IG and policy lead here at accuRx, and I look after all things information governance and security. And I'm just going to talk about the reasons why you can trust record access as a solution with the high standards of security that are applied to it. Let me just move it on. Okay, great. It's now working and responding to it. So, as I say, the three reasons that I want you to remember when you come away from this presentation about why you can trust record access are as follows. It's in line with all of the IG guidance issued by national bodies. You as GP practice always stays in control, as Satya, Matt, and Jacob have just outlined in different ways. I will summarize some of that and just kind of repeat that and why you always remain in control. And the reasons that you can trust it and turn it on are because of the secure methods of, it's a secure method of sharing the record, more secure than existing ones, I would argue. So on the topic of that national guidance, there's a fantastic resource that's been created over the last 6 months, the Nhs Ig Portal, which is issued by the Health and Care IG panel, which has representatives from these bodies I've listed on the right and others. So NHS Digital, the National Data Guardian, the late great Dame Fiona Caldecott, and I'm sure her replacement, Dr. Nicola Byrne, NHSX, representatives from the ICO, the Information Commissioner's Office, who look after data protection and regulate data protection indeed in this country, all have contributed and issued this guidance. You can click on the link that will come in the slides that will arrive with you after the session, so you can read it in full. They have specific guidance around digital solutions that allow patients to give permission for access to their GP record. They do note that there's no barrier to using this type of solution from an IG perspective, but the GP practice as data controller has specific responsibilities, and you need to check that you're happy with what is being proposed. So that's what we're covering here, and I'm just going to cover in the next slide. I would encourage you to make use of that portal. It's a really good resource. So record access has been designed to uphold all of the Caldecott principles, all 8 of them, including the newly updated one, which is about informing patients about the sharing that's going on with their records. And I would argue it goes one step further. It involves them as well, as Satya has just outlined, and I'll outline in a bit more in a second. So you as GP practices always remain in control. You always have the ability to enable the record access feature for records held in your practice's system. And you always have this user level audit trail of access. So every single user, it has their name hard coded into the text message that the patient receives and into the access, the audit trail of access, as Satya has just described, for your managed practice screen. And you essentially set out those conditions to us about when we can share that record with the requesting clinician and when we can't, when that fails. So I'm just going to explain how the patient does give that permission. So this is the text message that Satya's phone would have received just now. You can see that it names the clinician and the user, the accuRx user, requesting that record access. Our name will always be there, so it's only available to people using NHS Mail single sign-on, the record access feature. And that's a really key feature, that it's always linked to the individual requesting access. This 2-factor authentication, providing that code verbally to that requesting clinician is something that the patient has the power to do. They can choose not to if they aren't comfortable with that record being shared with them. And the full information about exactly what is being shared is behind that link. They can just click through and access that on their device, or copy it into another device if they wish to. So when they do that, as Satya described, they give time-limited permission by sharing the code, and something that you always have visibility of on the GP practices side. So these really high standards of security are why I believe that this is a higher standard than many of the other record sharing, or in fact all of the other record sharing facilities that you'll have access to at the moment. And we've developed this through extensive consultation, wide consultation with GP experts, IG experts, and national bodies like those that I described before. And so I know a lot of work has gone into this. We really appreciate all the feedback that colleagues who are on the call have given to date. And so I just want to recap those 3 key messages. It's in line with those IG standards set by national bodies. You'll always remain in control of it. And those secure methods of sharing the record through record access, the 2-factor authentication, the secure audit trail that you get, and the time-limited permission, where you should have confidence in this as a way of improving the care, improving the coordination of care for your patients across the system. So I'm just going to hand back to Matt, because I'm really happy to answer any more detailed questions on IG and security in this next bit of the session. But thanks for your time.
Thanks, Matt. Yeah, thank you for everyone, obviously, who's on the webinar. So that kind of concludes essentially what we had planned in terms of the intro as a demo and the section from Matt there now. We'll start to go through some of the questions. Some of our colleagues are working as a bit of a team just to try and collate and get the themes of questions as they'll come through. So we'll work through some themes now, but again, we'll just encourage you, please pop things into the Q&A that you're really interested in. Again, upvote on others, and we'll try and cover as much of these now while we can in the remaining time that we've got. So I'll probably try and pass these around to kind of a bit of the panel and people that you've heard from today, and answer some myself. But one of the first ones we've got in is, how would this solution be majorly different from what is on the summary care record? Satya, I know you mentioned that a bit in the demo. I wondered if you'd just be happy maybe just talking a bit more about how you see those as the difference of what comes through on the accuRx record.
Yeah, absolutely. I think the main difference is the ease of access for the record. So obviously this is with the patient's explicit permission and for the record to be shared. Traditionally with summary care records, you've needed kind of smart card access, especially if you're in a secondary care setting, which isn't always readily available. And so this kind of bypasses any significant kind of hardware barriers essentially to accessing the patient record, because you'll be getting consent from the patient directly themselves, and the underlying assumption is that you are obviously in contact with the patient for them to be able to share the 6-digit code back with you. I think the key difference is the information that's shared as well. So obviously there's there's more information that's brought back in the accuRx record share, so that includes immunization history, the last 2 years worth of investigations, and the health status, so BMI, smoking, alcohol as well, with the kind of basic information that you also get in the summary care records. So that includes the problem list and the medications as well as allergies. So there's a little bit more information. The reason why we've added that information is speaking to secondary care colleagues. This was the information that they wanted, that they didn't always have readily available when they were seeing patients. And so we imagine this is a feature that you'll be able to use for your own patients, but also will be able to, for other healthcare professionals to view the record when they're providing direct care for those patients.
Fab. Thank you, Satya. The next sort of kind of group of questions is around how does the patient share the code? Satya, obviously you showed in the demo that the code comes through at the moment via the SMS, and the expectation is that, at least in kind of what we've built today, is that the patient could share that either verbally if they're in the same setting as the clinician, or over the telephone, or a video consultation if that was happening. I think we are aware that not having a mobile phone at the moment is a barrier to this flow. I think with like a lot of the products that we build, I think we're sharing this at quite an early stage, and we want to make sure that we don't exclude people from these options, and we'll need to look into alternatives of how that could happen. So for example, there may be a way to do it where if you're as a GP requesting your own records, you may not need to contact the patient, or there may be able to be a proxy sent through to the practice to give permission on behalf of the patient. So those are a few of the things that we've I suppose thought about at an early stage, but at the moment where we are, we expect to if there is clear appetite for this, then we'll develop that to make sure that we can get as good coverage as that as possible. There was a couple of I suppose like other thoughts around on this one, just about obviously what some general questions around, like, what if the person doesn't have the phone? What if there are patients without mobiles? Are we creating a health inequality? And what if there are multiple numbers on the record? So things we need to look into. I don't know if Satya or Jacob or Matt, there's anything you want to add around kind of like the mobile step at the moment.
Yeah, so I'd be happy to talk about the mobile step. So I think in general, the fact that this is delivered by SMS, like SMS is one of the most universal technologies that we have. I'm aware that there are some people who remain digitally excluded, but SMS being like the basis for the delivery of this code should give you confidence that it's the most extensive way possible that you can include as many of your patients, because they are I think smartphone penetration is something like 80%. What's called like feature phone, which I don't think is a very helpful term, but phones that can receive SMSs are up closer to the top end of the 90%. So you can be quite confident on that front. But this is, so therefore it's one of the most universal ways of getting this kind of code to a patient, and then being able to then relay it onwards to the clinician. There may be ways, like Matt says, that we can further develop the product in the future, and enable the delivery of that code through other verified means. but this is the one that strikes the right balance between that inclusion and then also the security that we talked about before.
I think I'd also just add, there's no silver in anything here. There's no silver bullet, whether that's sort of how you communicate with patients, how you collect data from patients, how you, for example, share records. What we're starting with is, can we make the most straightforward cases a lot easier, so there isn't a barrier to accessing that information. You don't have to sort of just rely on that patient's history. If you want to check the record, and actually you can, like Satya mentioned, do that in 30 seconds or so. And then obviously we'll need to, like with everything we do, keep improving that. Certainly examples where patients are unable to give that, we need to address. But hopefully, by saving time for the majority of patients, it's then easier to call up a practice reception and get the information you need, because you have to do that for fewer patients. You've got a bit more time to do that, and that becomes more of the edge case, more of the anomaly. But very aware we need to sort of always keep improving things like that. On the SMS question, around shared mobile numbers, so like with all our messages, we sort of address at the top of the message who the patient is, so that it's clear who that's meant for. And obviously, by having their number on the record, we're using that as the basis for being able to send the message to them. A clinician is going to activate it, where they are with the patient, or they have explained that they're going to be sending the message anyway. So it's much less likely they're going to say, okay, I'm going to send you this message, and then that patient hasn't got the phone with them, because it would have likely been picked up by them.
Fab, thanks, Matt, and thanks, Jacob. Jacob, while you're on the hot seat, I don't know if you want to talk a bit more about the next one as well. There was some questions around the other types of providers being able to access. So it might be useful for community pharmacists. It could be good for a patient to share with a solicitor. Can secondary care use as well? Like that kind of thing. I didn't know if you just wanted to recap again how we see that being used across the settings.
Yeah, absolutely. So in terms of other providers, that's really the point. Is it's really, healthcare now is so complex, and for many patients they're being seen by multiple organizations, and it's very hard to keep track of exactly who should have access. And once they do, they have access to all patients. So what we're trying to do here is make it available to far more providers. So yeah, that includes community pharmacies, that includes not just secondary care, but secondary care in other parts of the country, not where your patient lives, but where they might be presenting, but where they can only access where that permission has been given, and it's documented that it's been given. Solicitors is a slightly different one, because they don't have NHS mail accounts. They're not accessing this for the purposes of direct care. And so that is an area we haven't, to be honest, looked into or touched yet. I know there is sort of a high volume of workload for practices associated with that. But I think in those cases, I'd worry a bit about just exposing things without sort of the practice being able to review exactly what's going out, and the way that they, if it's not going out to another healthcare professional providing direct care. But the whole, our whole aim is, regardless of where a patient is being treated, and that includes in private providers as well, where information from their records needed for direct care, like that is not a barrier to them getting the right care. And so yeah, that's exactly what we're trying to solve here.
Brill, thanks, Jacob. And the last one for the hot seat at the moment, if that's all right, is there was a question just around the charge and the cost for this feature as well.
Yeah, so this feature is free. It's something that we're really trying to join up practices and other providers here, and there'll be things down, a lot we want to build out, in terms of things like messaging. So another provider might look at a patient's record and then say, well, actually they've just been admitted to my care and I need some more information, or I need their care plan. And we want to work with systems and commissioners to work out how can we sort of add lots of value. But in terms of actually being able to just provide access to the record, that is a free feature, and that's going to stay a free feature for practices.
Brilliant. Thanks, Jacob. The next one was about will the GP practice have to accept the request? Would we need to do third-party checks beforehand? Matt, I wonder if you want to just cover a little bit about the process and obviously the discussions around that and the data sharing.
Could you just, you broke up a little bit for me there, Matt. So could you, I think it's my connection, but could you just repeat that?
Yeah, certainly. So will the GP practice have to accept the request? Would we need to do third-party checks before?
No, so essentially the way that this works is you set out those conditions to accuRx about when, what conditions do you need to accuRx to share that record to a third party requesting. So it's when the patient has given them that code. If that hasn't been fulfilled, it's not going to be shared. The other conditions I talked about NHS Mail single sign-on being used to log in on the requesting organization side, that has to be fulfilled as well. So they're all part of the kind of, when you choose to turn the record access feature on, that's you're kind of setting out those conditions. So it's only people who are logging in with those conditions. All that will be detailed in the data processing agreement and the policies that will and record access explainers that we'll publish on our website in good time. So you'll have absolute transparency about like when this will happen and when it won't. We're, in terms of third-party checks, we're really trying to minimize those for you, so that you don't end up in a situation where you might have to check potentially dozens, hundreds, thousands across the country of potential third parties that could access this. It's mainly about making sure that those conditions are fulfilled and putting the patient voice and their involvement right at the center of that. So they're the ones that ultimately make that call after you've switched on the record access feature. They are handing over that code or not.
Fab, thanks, Matt. So a couple, maybe I'll just go through a little bit more quickly here, just before I pass around. Does this rely on the patient having the code for access to record sharing on their record? What happens if they have opted out of the summary care record and therefore have not had their clinical information uploaded to Spine PDS? So the information is actually pulled from the GP clinical system. We use Spine PDS to match the patient. So providing we can have a match and they would still be on that system, then we could pull the record. It's not dependent on that code because the patient is asked each time, which is one of the advantages. So it would be absolutely fine for the patient to reject or say that they didn't want to share the record with someone who perhaps requested 1 week and maybe they were in a different setting a couple of weeks later, felt happier in that situation and were happy to share. So each time it would be a request for that view of the record for 24 hours. So it's not it's not something that's just on for the patient and then off at some point. For example, it would be based on each request. How frequently is the information updated? So when we actually pull the record at the point that the code is entered and confirmed as being the correct code, so providing that patient's record is updated in the GP clinical system, that would be like the latest snapshot of that. So there'd be a live view of that. Just having a quick check through some of these things here. There's a couple of questions here about just where the requests would appear in sort of like the audit trail. Satya, I don't know if you're happy to cover that or if you want me to.
That's fine, I'm happy to cover that. So at the moment we expect on the GP practice side, it will appear from the managed practice page. So you'll be able to see a full audit trail of which patients have had records requested, who's requested them, which organisation they're working at, when the request was made and whether or not the request was successful. We're still figuring out whether we notify every time a record request is pulled, and that's definitely something we'll be speaking to you all about as to whether you'd want to get a notification at the point that a record request is made, but you'll certainly have a full audit trail on the practice side, as well as kind of within accuRx web as well, to see which record requests are being made.
Fab, thanks, Satya. Sorry, just trying to go through some of the questions here. Can this be turned off on a patient-by-patient basis, e.g. a patient in a domestic abuse situation where the partner controls their mobile and they have asked the practice to make sure information is not shared, or does it pick up exclusion codes?
I can speak a little bit to that. I don't know if Matt might be best placed, but so if patients who are S flagged on PDS, so that means that their records are marked as like sensitive and not to be shared, you won't actually be able to search for those patients with an accuRx web, so you'll get a fail search return. So that's typically for patients who have been, victims of domestic violence, or who for other reasons their record should not be shared more widely. So for those patients, you wouldn't actually be able to request a record. With other patients, it's definitely up to the patient's permission. So where somebody does have control over their mobile phone, no patient identifiable data is shared in that initial text other than a request has been made. And patients can't use it as a way to bypass or view somebody else's record. It's only for a healthcare professional to be able to view that record. Matt, I don't know, I saw you on mute, so I don't know if you were going to say something else.
No, so you, I think that you've covered absolutely everything there, Satya, that I would add on that.
I don't know if this is kind of like a continuing theme there, sort of Satya, around, I suppose, in that example there, but also about what about patients lacking capacity? Yeah,
so I think we know that's kind of a barrier to use at the moment. Certainly if a patient lacks capacity, our assumption is that they obviously would not be able to give permission for their record to be shared. So currently this wouldn't really be appropriate to request a medical record for a patient that doesn't have capacity. They do need to be able to share that code with you in some way. And so if they're unable to do so, you wouldn't be able to use record access in this manner. Well, it's definitely something that we'll look at as we build out record access, but the first kind of first version of it is that it will go to an SMS code, the patient shares that code back with you.
Fab, thanks, Satya. Again, just a couple hopefully that I can get through here. Please, if I'm incorrect, anyone on the panel jump in. So would this work with newly registered patients that have not yet received their note GP to GP? So it would pull the record from the patient GP practice where they are currently registered on the spine, would be my understanding. So if they've been registered over to the new practice, but the GP to GP had come across that, the GP to GP transfer hadn't come across, then I suppose that might not possibly pull that across. I think that's quite a good sort of edge case that we'd need to test and double check on that one. But obviously it would pull what was from the registered practice. There was a couple of others on here. A couple of questions around sort of like the patient's number being on incorrect on PDS. We do know that can be a frustration. We've got with patient triage some data coming through around sort of how reliable those numbers are, and it would definitely be a frustration for that in patients. But I think we've messaged now over 30 million patients, so I think those numbers are probably getting more and more reliable each time. If the patient's number is incorrect at that point, it cannot be amended immediately, and I think there's a comment that could be very frustrating, and I think we agree at that point. One of the things that we would need to sort of kind of like make sure like as we roll this out in the future is that we're getting good success rates. The last thing we want is also users to kind of hit a brick wall when they're searching, because they won't keep doing this and then they'll return to sort of like burdening the practice with phone calls and asking for information. Which hopefully I think sort of like leads on to the next thing about what is the administration burden on the practice and what is the advantage over patients accessing online.
Could I just add?
Yep, go on.
Could I just add another safeguard that's in place in the kind of incorrect number case? So very small numbers, as Matt was describing, but the text message that is sent has a link to the full information. It specifically says, like, if you weren't expecting this text message, this is what you need to do. So that might be, and that might be informing informing the practice that sent it about the incorrect number. So it sets that out for unintended recipients who are going to be a really tiny number, just exactly what to do there, so you can get that fixed up.
Thanks, Matt. Yeah, so one of the other questions on here is, what is the administration burden on the practice and what is the advantage over patients accessing System 1 online? So obviously the primary use here is for clinicians to access that record, and what we're hoping is that it will remove quite an administration burden, that if the practice are happy and have this feature on, the clinician that would like access to the record basically goes direct to the patient, and the patient makes that decision, and then you would receive the audit of that. So it's not for the patients to look at their own information. So I suppose a bit of a different setting there, as far as I understand that one. Satya, I think we've discussed this before, but just briefly, it would be good to get your thoughts. How do you deal with patients' records being print screened?
I think my personal view on this is at the moment, where kind of the record is emailed across, or somebody gets a copy of the record, there's nothing really to stop them taking a screenshot of it on their phone, for example, currently. I think where we're different is we return a view of the record. That's viewable. You can come back to that anytime within 24 hours to get the information that you need. We haven't made it kind of easy or in any way to kind of copy or download, etc. That record and I don't think we will do, just from a safety perspective. So the onus is really on the clinician to do, to handle medical records like they normally would, which is the advice is don't take screenshots on your phone, don't download it and then lose it. And similarly to kind of the way that paper records, etc. work at the moment. What I think is really beneficial here is that there isn't any need to do that. If you can keep returning to the record within a 24-hour period, get the information that you need off it, and then you've got the relevant clinical information to move forwards. And so my very strong hope is hopefully we've kind of avoided that need where typically people will need to take screenshots of their record and then share that around.
Thank you, Satya. Is this just NHS England, or will it be able to work across borders, e.g. patient moving to Wales or Scotland, a new GP needing to access list of medication? My understanding of this is that it would be England and Wales at the moment because of the use of the NHS number and PDS, and also the integrations that we have with the GP systems. And that answers another question a little bit further down about where is this information coming from? Is it from the SCR or GP systems? And it is coming from the GP systems. Jacob, this might be a good one for you if you're happy to answer, just sort of about the landscape again. So our area is launching a full shared care record, which will include GP records, hospital records, mental health, etc., and can be accessed by primary, secondary, community, and emergency care. Is this going to be able to link into this sort of system, or would that be a later third-party to third-party development?
So initially, we're just flowing things from the GP record. And yeah, obviously aware that quite a lot of areas are rolling out sort of place-based access systems, and we spoke through some of the barriers that patients being out of area and staff not having the right access, or smart card access and things like that, and that's sort of the reason we've gone down this route. Obviously, over time, we're very keen to expand it so that you can get access to a wider set of information. So, for example, in general practice, you could request access to information from secondary care or from another setting, but where we're starting is in general practices, because obviously that's sharing, sort of allowing patients to share the records from general practice, because that's obviously where most of our adoption is at the moment, and so we can offer very wide population coverage. I just wanted to sort of, while I'm speaking as well, just also pick up the questions around, patients using System 1 Online and patient access and things like that. And I think it's a really good example of where there are, good workarounds at the moment, and people will, try and solve this problem by, for example, doing that. The big sort of barriers we've heard is not all patients have access to that. They need to have a smartphone, they need to have set up their linkage key and have an account where they can log in, or even if they're doing it in the NHS app. And sort of when they do, it's all dependent on the level of information that you're sharing with patients. So we're sharing more than is in those systems and that you would expose to your patients, less than if you were just sort of exposing to your own team in the practice, where you'd obviously give a lot more information. And that's sort of one of the key areas, is you can control what you're sharing with patients, what patients can view separately from what other healthcare professionals can view.
Perfect, thanks, Jacob. Matt, the other Matt, very confusing even for us inside accuRx. The other Matt, there's a couple of questions, I think you've seen them around, so the patient becomes a data controller and accuRx is a data processor, and some others there. Are you happy to pick those up?
Yes, so very happy to pick these up, Matt. So just to kind of, I think actually if I take control of the screen, I can navigate back to some of the slides we had. But essentially, the GP remains the data controller for the medical record and is setting out instructions to accuRx about how to process its data and make it available to people that meet those conditions that we've talked about throughout this webinar. The third-party organization that's requesting access, and if indeed it's granted by the patient, they become a recipient of that data, but they are also bound by the same data processing agreement that we have in place with GP practices. So anyone that's using accuRx as part of the terms and conditions of using our platform has this same agreement. It's really good because this is a standardized across the piece, and it helps to inform all of the people involved in sharing this data about their obligations about it. And it also, and just to bring on to the kind of the print screen question that Satya addressed before, if that's something that indeed the receiving organization wishes to do, that's very much something that they have to establish for themselves, whether they have the right to do that, whether they have the right to take the data and do further processing afterwards. So essentially, it's like a bit like, if you send them through the other workarounds like Jacob was talking about, like emailing full copies of the record, it's essentially on them. And the data processing agreement that we set out makes it very clear that they need to be using this for direct care. They've got a whole set of legal obligations about that as well. There's another question that came in about whether, on this same theme, about whether that secondary care provider could do this without beyond the scope of data sharing arrangements. Data sharing agreements is something that has come up in our kind of, there's a bit of a concern out there that you need to have a data sharing agreement between every single organization that shares data and those that receive it as well. And this is something that we engaged extensively with the National Data Guardian in particular. So she issued her letter and it's available online. So in the slides after this, she asks you to read in full, but I've just pulled out the bit that specifically addressed whether you need to get those data sharing agreements. Would be potentially hundreds or thousands across the country, or whether a standard data processing agreement in place between accuRx and those organizations is something that is acceptable. And she thought it was entirely seemed very reasonable to her and the members of her panel. So that should give you some confidence there that that's not something you need to go and put in place. On top of this, we've got that covered for you.
Thanks for that, Matt. There's a couple of questions, I think, sort of around some themes in here. So, can shared patient information be ring-fenced, i.e. just medication? Are you planning to provide an option to share attached documents? Can people see test results? Are the test results included? Satya, I don't know if you want to cover any of our thinking around kind of like what's in and what's out at the moment.
Yeah, sure. So currently you can see investigations going back to the last 2 years, and the information that's included in the record includes kind of the problem list, the medications, allergies, smoking, alcohol, BMI status, immunizations, and investigations. And like I said, the rationale kind of behind that was we know that summary care records are quite restricted in what they show, and often healthcare professionals that are accessing records remotely, whether for their own patients or if they're, a registrar in A&E, need a little bit more information about the patient than they can get back in a summary care record. So that's the rationale behind including that information. And again, if you're a GP who's doing your own patient's record, you will be able to see the last 3 consultations as well. The reason why we haven't made that available to everyone is just because we don't want to expose third-party information unnecessarily. In terms of going forward and adding letters, clinic letters, etc., I think it's definitely something that we want to do. We know there's real value if you're referring a patient, to heart failure clinic, that the consultant can see the last few clinic letters about that patient. It's not something that we've built yet, and it's something that we'll do lots of testing on to make sure that we're not exposing lots and lots of like letters, etc. But I imagine, with kind of good takeoff record access, it's definitely something that we'd want to build out to make it more and more useful. Thanks, Matt.
Thanks, Satya. So I think that covers kind of some of the ones around like the test results and our plans. That I think what we're showing you here is a first iteration, and we'll want to continue to sort of work on these and develop these as we go through. There's a couple of questions here. Like, would patients feel Suspicious, if their own GP surgery clinician working remotely ask for permission to their GP records. Matt, I don't know if you wanted to cover this one.
So I think it depends on the functionality that's in record access. So when you request access to your own records, if correct me if I'm wrong, guys, but if you're a user that's linked to the organization, the GP practice that patient's registered at, you don't need to go through that additional step of getting the patient's code from the SMS that's delivered to them. I think that's the way it's been working when we've been iterating on this, using the test practices who've signed up to test record access with their own patients. Correct me if I'm wrong on the plans here. That's something that we're really interested in to test with people, because I agree that would be something that would be a bit of a, hang on, don't they already have access to this? So it would only be for external recipients.
Yeah, I think that's something that we've started looking into. We've not put in place yet, but as you said, Matt, we would know that that patient was registered at the home practice. That person would have an accuRx account. They'd be logged into an Nhs or System 1. So it's something that we could probably bypass in that flow to make it a lot easier, both for the patient, but also for the clinician out there doing visits.
Really, and the other really important thing to remember is in that accuRx practice, the accuRx admins would have been able to approve that user or unapprove that user. So it's something that is, you have control over the users that would be able to see that.
There's a couple of questions just about accessing the information, I suppose, once it's been shared, and this is a little bit like the screen recording or the print screening. Obviously, it's viewable as a web page, so a clinician can print or save an image of that if they wanted to or needed to put information into another system or another community system. Obviously, what we're hoping is that the flexibility and ease of this and having that communication makes that a lot easier for clinicians sort of across the piece to get the information when they need it, rather than lots of copying and pasting. But it would be possible to do that so that they can update the other records that they need to as they're going through. We don't, Jacob covered this a little bit earlier, but we can't or we don't pull from secondary care yet. So primary can't request from secondary care. Again, I think the longer term vision and the longer term roadmap would definitely cover that. Is where we'd love to be. We want everyone to, who's involved in a patient, be able to communicate about them, and we believe that having the important information from the record is going to be the key thing to doing that, so they can go through and answer the questions they need to. I think we're coming towards kind of like grouped question list. Matt, the other Matt H is probably just another one for you here, if that's all right. There's a question of saying, is the only process going through, or the only security through, the NHS mail account and a mobile number on the spine? I don't know if you want to just cover again, where we've been through with NHSD and the Caldecott Guardian on that.
So in line with those, as well as those things, and involving the patient in that decision to hand the code to the clinician that requested it. There's also the audit trail that's on the side of the GP practice. It's made aware of anyone requesting it as well. They are explained to them that they are using it in this way, that their use of record access to get access to a patient's data will be logged and will be available to that GP practice. That's another thing that you can have confidence in. I think I would say that the things you'd have to have access to all of, to the NHS Mail single sign-on, to the device that the code lands on, and then also be able to obfuscate that kind of information on the audit trail as well. It's a pretty high bar, much higher than others in terms of record sharing systems, which don't necessarily identify the individual user, for example, in terms of their audit trail. So I think we do set a pretty high bar on the security here. Really happy for people to suggest other ways to improve it, or things that we have not yet thought of, but I'm very confident in it.
Perfect. Thanks, Matt. And I'm conscious of time, which means we're very near the end now. So just before we wrap up, a couple more very brief slides. We'd love to run our poll again. So I ran this poll at the start. where we asked people if you believe you would find this feature useful, if you would like this for your patients. Obviously, hopefully we've been able to provide a bit more context now of kind of both how we plan to do this and kind of the benefits that we think it will bring. Obviously, we're also aware of, we still have plans to develop and iterate, but it'd be really useful for us to just kind of get some more feedback on the information that we've covered today, if that's the right kind of thing. So I'll just give a few more seconds for anyone to click through on that one. It's not quite as interesting because it's the same question again, so apologies for that. Cool, last 5 seconds. Brilliant, thanks very much. And I'll just share those results again. So from everyone that voted there. So we really appreciate you taking part in those couple of polls as well. It's just some sort of like useful benchmarking information for us. One of the big questions that came up, which was really nice to hear, is like what's next. So if you're interested in piloting, you can get in touch with us via support. We will also be sending out a follow-up email to the webinar afterwards. It's really great to sort of see that there's been quite a few of these coming in and people are interested to pilot. That's the way we learn the most and be able to make the right changes and iterate quickly on this. So yeah, either drop a message into support or follow up to the email where we'll give some instructions about how we're planning to take this forward next. Again, just to say to everyone, thank you very much for joining. Appreciate an hour's a long time out of the day. Hopefully this was really useful. It's really valuable for us to hear feedback and also get kind of the challenge through the Q&A. So thank you. We will post a recording on the YouTube channel shortly. And again, for any other questions regarding things that we perhaps didn't have time to cover today, whether that was accuRx Plus or accuBook or anything like that, please do, again, jump onto the support and either have a chat with the team on live chat or look through some of the great articles. Brilliant. Thanks, everyone. And yeah, hopefully we'll all catch up again soon. Thanks a lot. Bye-bye.
Thanks. Bye.
Thank you.